So, as was said, I've been a breathwork practitioner working in a sort of independent therapeutic basis with clients, and practicing that since 2002. But my organization, Global Grassroots, works in East Africa and predominantly in Rwanda, and also we have a program in northern Uganda, where many of our participants are survivors of genocide, survivors of conflict, gender-based violence, and long-term chronic stress. And I knew from an early phase of our work with these communities of women and young women that there was a level of stress and PTSD that was going to inhibit their ability to move forward in their lives. And the focus of our program is to help women and young women develop their own ideas for social change so that they can start their own nonprofits that improve their own communities. But they often are the ones that have the least access to the resources and opportunity to attend to their own well-being and rehabilitation needs, and that was going to be a really critically important component of our work. But here I was unable to live and exist long-term within these communities. I'd have to be able to work across language barriers and cultural differences, and it would be with a translator almost impossible for me to do my one-on-one long-term work. So I went in search of a practice that we could do with groups that would be evidence-based, that would be immediately effective so people could feel the difference, especially when you're sharing something that's so different and so foreign. It's really important for them to, in the very first experience of it, feel a difference in their bodies, to be able to trust and want to continue that practice. That would be safe and easy to learn, accessible to them without needing to travel long distance to find somebody to do this work with them, and that they could learn over time and share with each other. And so when I first went to a lecture that Dr. Brown and Dr. Gerbarg gave at a medical college in Boston, I was immediately impressed with everything that they had to share, and I knew that I wanted to learn more. It just so happened that the Haiti earthquake happened before I could investigate a training program. And I got on the phone saying, is there anything you could teach me over the phone that I could just bring to Haiti? And I went first to do rescue and recovery work, and later in between trips had the opportunity to train directly in the program and bring it back to Haiti. And soon thereafter, we brought it into our programs in Rwanda and in northern Uganda with women and young women who have experienced a lot of trauma in their lives. It is very powerful. It is, as I said, it's felt immediately. Many of the groups of women learn over the course of a 2-week intensive residential program that we do with them, and continue on in their teams to practice it together during all of their regular meetings. And for many of them are practicing them years and years later. Some of the same techniques that they learned, it becomes a core to their program. All of our staff, many of them have been trained as level 1 and level 2 practitioners, but we are ensuring all of our programmatic staff are trained during this session now, so we can have even more exposure within Rwanda and Uganda. I'll just share that it has been profoundly transformative to them personally as well. And during COVID and throughout many other circumstances that have affected these communities, from landslides and other disasters, BBM has been the thing that these communities ask for and want more of, and share with each other. So it's been a profound practice for Global Grassroots in our organization. And we continue to try to be involved in promoting it and teaching it and sharing it with others.